Hello and welcome everybody to my presentation on the anatomy of the knee. Um, if you can hear my mic right now, I just want everybody to give me just a thumbs up. I'm leaving this on discussion mode right now because of the small group, but for now, let's hold questions until the end of this PowerPoint presentation. If you do have a question at any point in time, use the chat box here. So you just might say, if you didn't catch something, you know, what is the ACL, just for example. So if you have any questions for right now, either put on the chat, or what you can also do is come over here to the notes, and if you just put the notes up at the end of this presentation, it will all be emailed to you. So if you have any questions, or anybody else has any questions, or comes up with a question, and the whole class would like to know, these will all be emailed out to you, and you can get that information after the meeting as well. But the first thing that I would like to know is just what kind of prior knowledge that you may have on knee anatomy. So if everybody could take just a few moments and just answer this poll for me. Does anybody have any prior experience with knee anatomy? Just take a few moments and do that. Okay, so it appears that we have, the majority of us have a general understanding of knee anatomy. Another thing I would like to know, and you don't have to answer this if you don't want to, and know it's kind of personal information, but has anybody ever had any knee injury before? So if you didn't have any prior academic knowledge of the knee anatomy, maybe you've had some personal experience with just from injury, things that you might have heard from the doctor, your trainer, things of that nature. Okay, so I see that we had some general knowledge. There were some knee injuries, so that's good. Hopefully that'll keep you up to speed and able to follow along fairly easily. So we're just going to jump right in here to the PowerPoint presentation. And the first thing that I would like to focus on is the bony structure of the knee. Not too complicated. It's only the knee complex is really only comprised of 4 bones. They're comprised of the 3 we call long bones: the femur, the tibia, and the fibula, which you can see here. Femur, tibia, fibula. And the patella, this is unique. This is a sesamoid bone, meaning it's not connected to the bones with ligaments like all the other bones are. It's just loosely held on with the patellar tendon. We'll get to that in just a second. And here you can see the front, side, and back view of the knee, just give you an idea of how the bones articulate with each other and how they fit together. And now we're going to come and talk about the meniscus. The meniscus serves as a shock absorber to the knee, and it fits. Like, here's the tibial plateau. You're looking at the tibia right here. What's missing from this is the femur would fit right down on top of it. And these 2 meniscus, they consist of fibrocartilage or fibrocartilage discs. You have a medial and a lateral meniscus, as you can see here. Just means the inside of the knee, the outside of the knee. Provides cushion and stability. Maintains a little bit of space between the femur and the tibia, preventing any sort of grinding of bone on bone. And they're really poorly supplied with blood, which is important to know because, as you may know already, that it takes an adequate blood supply for any sort of injuries to heal. So if there are any tears to the meniscus, it's almost always going to result in a surgery. I just wanted to get that piece of information out there. I think that's important to know. So now we're going to come in and talk about the ligaments. The ligaments are what hold the bones together. It keeps them in place. It keeps the knee structure, well, structurally sound. And you have 4 major ligaments in the knee. They are the ACL, the PCL, the MCL, and the LCL. Again, I wanted to give multiple views just so you can see how it fits into the knee. So we have a back view and a front view here. You can notice that you always notice a back view because there is no patella, like you see right here. Patella always in front, never in the back. And I put this up here just so you can see the importance of these ligaments. The ACL, or the anterior cruciate ligament, prevents the femur, which is the bones you see here. So imagine this is the front of the knee and this is the back of the knee. It prevents the femur from sliding forward, and inversely the posterior cruciate ligament, or the PCL, prevents the femur from sliding backwards. Very important that these ligaments stay strong. You can see here, here's another picture of the meniscus, which we just recently talked about. Because whenever these things slide back and forth, there's a high chance, a high rate of injuries to meniscus. They can also become torn, so not only are you left with maybe one injury to a ligament, you're also left with a meniscal injury. And the same thing happens for the lateral collateral ligament and the medial collateral. So, you know, inside of the knee, outside of the knee, and they prevent this motion from the femur, which can also result in meniscal damage. The joint capsule allows for a smooth movement of the knee. And what the joint capsule is just this fluid-filled capsule that surrounds the knee joint. All of your ligaments would be in here, and your meniscus would be in here. The joint capsule in the knee is the largest in the body, and it's filled with what we call synovial fluid, and it just provides some lubrication to the joint, so there's not a lot of grinding, rubbing of tissues together, anything of that nature. And you will know if this capsule ever becomes injured or ruptured, it will have a huge swelling, this big watery looking thing on the surface of the knee. If you've ever heard anybody talk about having water on the knee, that's what they're referring to. And here I want to come in and talk to you about the musculature. We're just going to hit this really quick. I know you see a lot of names here, but again, this is the front view of the knee. You can see the patella here, and this is the back view. And the musculature for the knee joint is just any muscle that crosses the knee joint, any muscle that has any impact on the knee. They're responsible for all knee movements. Just real quick, the important ones to know would be the quadriceps, which would be found in this area, your thigh, the big fleshy part of your thigh. They're responsible for knee extension. And these muscles back here, your hamstring group, which you can see here, the biceps femoris, the semimembranosus, the semitendinosus, all comprise the hamstring group, and they're responsible for knee flexion. And if you remember earlier, I talked about the patellar tendon right here, holding the patellar tendon down. And you may remember me talking about the uniqueness of it, that it's not held together with the ligaments. What that allows you to do, or the patella to do, is slide up and down the bones and move a little bit. And if you kind of take time and just put your hand on your patella right now and just kind of straighten your knee and bend your knee, and you can kind of feel it move up and down, and you'll kind of get an idea of what I'm talking about. Last thing that I really want to talk to you about right now is the bursa of the knee. You have 5 of them. You can see them right here. They're highlighted in blue, and again, they sort of serve the same purpose as the the synovial membrane, it just allows for free movement with and keeps tissues from rubbing up against each other. Here you can see, for example, the suprapatellar bursa fits in between the quadricep muscles and the femur, just prevent them from rubbing together. If not, over time, it could be a rubbing away of the or erosion of the muscle, and that can create some problems. So they just fit here again to allow the knee to move a little more smoothly. Okay, that's going to conclude our PowerPoint presentation right now. And the next thing I want to do is, I don't think, well, we may have some time here. Oh, sorry, wrong thing. I meant to come to YouTube right here. There is a quick video that I want to show you, and I'm gonna play it, but I'm also gonna mute it. I just kind of want to give you an idea about how the knee fits together. Here you can see our major ligaments. They're alright, medial collateral ligament, this is the inside of the knee. We're going to come to the lateral collateral ligament, which is the outside of the knee. And you can kind of see, this is what I'm talking about. It keeps, see how the tibia goes back and forth here? These ligaments keep it from doing that and really sliding back and forth. And here we have our ACL and our PCL, and we're just elongating it here so you can get an idea of how they fit in there. Obviously, it's not going to look like that on a normal knee. We just want to increase the joint space to give you a better idea of how they make this little X pattern in here. We're going to rotate around, and there we go. Now we got the flexion and extension of the knee. And without these here, you'd get a giant shift, as illustrated here. And that's something you definitely want to avoid to prevent any real injury. And also I wanted to point out, there's meniscus here too. It's not as easily to see, but that's pretty much all. I just wanted you to see that right there, to actually get a visual for how the knee moves. If you do like to see a little bit better video, a little more in-depth video, just want to take time right here. I'm going to go ahead and share my screen. Share the full screen. Okay. And if you so choose, you can go to, oh, it looks like we're not going to have enough time right now. I will get that information to you later. I'm going to stop screen sharing for now. And one last thing that I would like, just to give me an idea about what I need to cover next time, is if you can also take a few moments to just sort of how you thought the presentation went. Be honest. We'll use this information later to help change things I need to about the presentation, or keep some of the things that I need to about this presentation. Okay, so just somewhat increase my knowledge of the knee, so thank you very much for your honesty. I definitely will be working on this for the next time. And if anybody has any last minute comments, questions, like I said, don't be afraid to ask. You might want to, again, use the note option. Just found up here. That way everybody knows what questions were asked and the answers to those questions. So thank you very much, and I will talk to you next time.